Hello and welcome, my dear colleagues. We're truly delighted to have you with us. My name is Oksana Galibova, and I'm the Network Director of Person-Centered Services at Medisys Health Network. Now, we are going to take you on a journey, one that will show you how our hospitals support communication with patients who speak little or no English. We'll explore the language access and auxiliary aid services available, and most importantly, how you can use them to deliver safe, high quality, and compassionate care. Thank you.
Let's begin with something that's often misunderstood. Patients with limited English proficiency, or LEP, are not necessarily people who speak zero English. Rather, LEP refers to patients whose primary language is not English and who have difficulty reading, writing, speaking, or understanding English well enough to navigate a medical conversation. And that really matters, because healthcare depends on clarity in communication. If a patient can't understand instructions, ask questions, give informed consent, or explain how they feel, the quality of their care will be compromised. That's where we come in. Our Language Assistance Program is here to break down those barriers. We offer 6 key services. 1. Interpreting. 2. Bilingual Competency Identification. 3. Medical Interpreter Training. 4. Translation. 5. Auxiliary Aid. 6. Health Literacy-Oriented Editing. These services exist to ensure that language is never a barrier to healing, and they are available to LEP patients right here, right now.
Let's test your instincts. Do you know the difference between an interpreter and a translator? Many people use the terms interchangeably, but they're not the same. Here's the trick. Interpreters work with spoken or signed language. Translators work with written text. So if someone says, "There's a Japanese-speaking patient here, can you find me a Japanese translator?" What they probably need is a Japanese interpreter. Knowing the difference helps us get the right expert to the right place at the right time.
Last year alone, we provided interpreting services in more than 120 languages across our health system, including American Sign Language and other sign languages. At Flushing Hospital, the top 5 requested languages are Spanish, Mandarin, Bengali, Korean, and Cantonese. At Jamaica Hospital, they are Spanish, Bengali, Mandarin, Punjabi, and Arabic. And here's something you should never forget. These services are absolutely free for our LEP patients. Why? Because it's not just the right thing to do, it's the law. Language access is required by federal and state laws and regulations, the Joint Commission, and our hospital's own policies. Let's zoom out for a moment. Why do these laws exist in the first place? Because in healthcare, communication isn't just important, it's everything. So what happens when a patient can't describe their symptoms or understand a diagnosis in English? That's where language access laws step in. It started with Title VI of the Civil Rights Act of 1964, which states, "No person in the United States shall, on the ground of race, color, or national origin, be denied access to services receiving federal funds." Although national origin was included as a protected category under the Civil Rights Act of 1964, language was not explicitly mentioned. For the first 10 years after the act was implemented, it remained unclear whether language barriers could legally be considered a form of discrimination. As a result, countless individuals, especially immigrants and non-English speakers, were denied access to essential services, including education and healthcare, simply because they couldn't communicate in English. It wasn't until 10 years later that things began to change in a meaningful way, thanks to a class action lawsuit and a landmark Supreme Court ruling that established a powerful legal precedent for language access rights. To tell us more about that turning point, I'll now hand it over to my colleague Stella.
Imagine a world where you couldn't understand your doctor, your child's teacher, or the instructions on a vital document. This wasn't a far-off fantasy for many in the 1970s. In San Francisco, Thousands of Chinese American students were essentially locked out of their classrooms because they didn't speak English. While the school district argued that everyone had the same access, these students were struggling, and that's when a group of determined students and their families said, "Enough."
Mrs. Lau came in to our parent-teacher conference, and she said, "Miss Lee, I come from Hong Kong, and we speak English and Mandarin and Cantonese. Why can't you, as a Cantonese-speaking teacher, why can't you teach Kinney math and Chinese?" I didn't know how to answer her.
The case of Lau versus Nichols was a class action lawsuit brought by Kinney, Kim, and Lau and others against the San Francisco Unified School District. These students argued that providing the same classrooms and textbooks wasn't equal when language barriers were ignored. This wasn't just about education. It was about fundamental fairness, about being seen, heard, and understood. They argued that the lack of language support was a violation of Title VI of the Civil Rights Act of 1964, which prohibits discrimination based on race, color, or national origin in federally funded programs. The case went all the way to the Supreme Court. In a unanimous decision in 1974, the Supreme Court sided with the students, stating that identical treatment does not constitute equal treatment when it comes to students with limited English proficiency.
I had KCBS on, and the 8 o'clock news, the lead story, U.S. Supreme Court rules for Chinese-speaking students. I won!
The court declared that if students don't understand English, they're essentially shut out of a meaningful education. This was a watershed moment, a legal earthquake that shifted the landscape of language access in the U.S. This ruling didn't just apply to schools. It sent a ripple effect across all sectors receiving federal funds, including healthcare. Suddenly, hospitals, clinics, and healthcare providers realized that they had an obligation to provide language assistance services.
Thank you, Stella. Following the Lau versus Nichols ruling, language was confirmed to fall under the category of national origin. This clarification had a major impact, especially in healthcare. From that point on, any hospital that receives federal funding, including ours, has been legally required to provide meaningful access to care for patients with limited English proficiency. That means using professional interpreters, providing translated materials, and ensuring systems are in place to support clear and effective communication for every patient, regardless of the language they speak. Then came Section 1557 of the Affordable Care Act, the first federal civil rights law to specifically ban discrimination in healthcare based on national origin, including language. Under Section 1557, qualified interpreters must be provided at no cost to patients. Family members, especially minors, should not be used to interpret unless it's an emergency. Critical documents should be translated into the patient's preferred language. And we cannot forget the Americans with Disabilities Act, passed in 1990. It protects individuals who are deaf or hard of hearing, and mandates that hospitals provide qualified sign language interpreters when needed. It builds on earlier laws like Title VI of the Civil Rights Act and the Rehabilitation Act of 1973. In a word, language access isn't a luxury. It's the law. And more than that, it's a vital part of delivering safe, respectful, and equitable care. Dear colleagues, what we've just covered explains why we are required to provide language access services. Now, let's shift our focus to the how we can ensure that patients with limited English proficiency have meaningful access to healthcare and medical services every step of the way.
Patients' preferred language is documented in EPIC under their demographic information. If it hasn't been entered yet, don't worry. We have a helpful tool for that called the Point 2 Language Identification Chart. Simply show the chart to the patient, and they can point to the language they're most comfortable using. The chart includes our most commonly requested languages, and clearly states that interpreting services are provided free of charge in multiple languages listed. It's a quick, respectful way to identify a patient's language and ensure they get the support they need right from the start.
Out of the 6 major services we provide, let's begin with the one you'll likely use most often: interpreting. Now, you might be wondering, how is it possible that your department provided interpreting services in over 120 languages last year? Just how many people do you have on your team? Well, here's the secret. While we do have a dedicated team, the majority of our interpreting services are delivered remotely through trusted vendor partners, and we coordinate those services to make sure they happen smoothly and promptly. In a nutshell, our interpreting services are provided by a network of qualified medical interpreters through 2 main modalities: remote and in-person. Let's start with remote interpreting. These services are available 24/7 via video or phone through our 2 trusted vendor partners, Voice and Language Line, covering over 200 languages, including American Sign Language. To support this system, we've deployed more than 200 iPads on roller stands across the Medisys Health Network, each equipped with the Voice app. When you return to your department after orientation, be sure to ask your colleagues where your unit's Voice iPads are located. The app is user-friendly and intuitive. Even if it's your first time using it, you'll find it quick and easy to access an interpreter. Now, let us show you how it works with a quick demonstration. Once you open the Voice app on the iPad, this is what the interface will look like. First, you'll want to press the blue phone icon in the middle, which leads you to the next screen to select the language you need. On this screen, the last language requested will show, but if you need another language, click on the magnifying glass to change the language. Here you'll see a list you can scroll through, but you can also type the language in the search box at the top. Once you select the right language, you can see additional options in blue to select audio or video, as well as interpreter gender preference. These are optional. When you're done, just go ahead and hit Next to begin connecting to an interpreter. It usually takes under 60 seconds to connect to an interpreter, but sped it up for this demonstration. You'll then be connected to the interpreter, and they will begin to introduce themselves with their name and interpreter ID number. This information will also be on screen. Tap on the red phone icon to disconnect. If you were accidentally disconnected, you may press the Reconnect button or hit the I'm done button if finished. The last screen is an optional quality rating and feedback you can provide about the interpreted call. By pressing Next, it will take you back to the home screen of the Voice app. In addition to the iPads, over 400 Epic Rover phones across the system have also been equipped with the Voice app. The functionality is exactly the same as what we demonstrated on the iPad. The only real difference is the screen size. Whether you're using a Rover phone or an iPad, accessing a video remote interpreter is quick, easy, and consistent. In addition to video interpreting, remote interpreting by phone is also available. You'll find the phone number or extension listed in your handouts and on the Language Bank page. To access the service, simply call the number, follow the voice prompts, and select or request the language you need, and wait to get connected to an interpreter. Once connected, be sure to take note of the interpreter's name and ID number, as this information is required for proper documentation in the patient's Epic medical record. Some of you will receive additional training on how to document language services in Epic, depending on your job responsibilities. Since that will be covered separately, we won't go into further detail here. The in-person interpreting service is provided by 3 groups of interpreters. First group, 5 in-house staff interpreters who provide in-person interpreting in American Sign Language, Spanish, Mandarin Chinese, and Brazilian Portuguese. Second group, on-site sign language interpreters from our partner agency, ASLI, for deaf and hard of hearing patients. If you ever need to schedule one of our in-house interpreters or interpreters from our partner agency for an outpatient appointment in person, it's simple. Just email us the details: time, location, duration, topic, patient MRN, contact person, phone number, and any other relevant information. We have a template available to make this even easier. You can find the template on the Language Bank page on the Medisys intranet. Here's how to get there. 1. Go to my.medisys.org. 2. Click on Employee Resources at the top. 3. Then select Language Bank. You'll find request forms, quick reference guides, tip sheets, and other language access resources there. If you remember only one thing from this orientation, make it this. My Medisys, then Employee Resources, then Language Bank. That's your one-stop shop for everything language access. The third group of in-person interpreters are called Staff Qualified Medical Interpreters, or QMIs. These are bilingual employees who have completed at least 40 hours of medical interpreter training and are approved to interpret in clinical settings. They are dual-role employees serving as interpreters on a voluntary basis. You can also find their names, departments, and extension numbers on the Language Bank page. Now, one very important reminder. Only qualified medical interpreters, those who have completed at least 40 hours of interpreter training, are allowed to interpret during medical encounters. All the interpreters from our vendor partners, in-house interpreters, and staff QMIs are all qualified medical interpreters. Untrained bilingual staff are not permitted to interpret, no matter how fluent they are. This isn't just our policy. It's a requirement under federal law.
To all of our bilingual colleagues, your language skills are equally needed and deeply valued. During your onboarding process, you may have already completed our staff language skills survey. If you haven't yet, you can scan the QR code on the screen now or do it later when you have a moment. This survey helps us identify qualified bilingual or multilingual employees across Medisys. If you pass the screening based on your responses, your name will be added to our qualified bilingual employee list. And here's the exciting part. Once you're on that list, you are authorized and encouraged to communicate directly with patients in their preferred language, if you share the same language, of course. For example, if you're a qualified bilingual employee in Haitian Creole and your name is on the list, you can speak Haitian Creole directly with the patient who prefers that language, even when discussing clinical care. You can also obtain informed consent without the need of a professional interpreter. Of course, interpreter services are always available to support you. If you ever feel unsure about a complex medical term or a phrase, don't hesitate to call an interpreter. We're here to back you up. Your bilingual superpower helps us deliver care that's not just safe and effective, but also personal, respectful, and culturally responsive. Let's clarify an important distinction. As a qualified bilingual employee, you are authorized to communicate directly with the patient who speaks the same language as you, but you are not allowed to serve as an interpreter. Simply put, if you and the patient share a language and your name is on the qualified bilingual employee list, you can have a one-on-one conversation with them about their care directly in their language. However, if a colleague asks you to help them communicate with a patient, that's considered interpreting, and it's not permitted unless you're a trained and qualified medical interpreter. Who else cannot serve as an interpreter? Family members or companions, even if they speak the same language, should not be used as interpreters in a medical encounter. Here's why. They are not trained in medical interpreting. They are often not impartial, which can affect the accuracy and neutrality of the communication, and most importantly, they cannot provide consent on behalf of the patient unless they are the patient's legal proxy or guardian. Using unqualified individuals to interpret can lead to serious misunderstandings, medical errors, and legal risks. That's why federal regulations require the use of qualified medical interpreters for clinical encounters. Interpreting is a recognized profession with its own code of ethics and established standards of practice. It requires formal training to ensure accuracy, confidentiality, impartiality, and patient safety. But what if a patient with limited English proficiency refuses the offer of a free professional interpreter and insists on using a family member or companion instead? In that case, they may do so, but only if the chosen person is at least 16 years old. You must also clearly document the patient's refusal in their medical record, including the name, age, and relationship of the person who interpreted. And as a reminder to our bilingual staff, your language skills are a tremendous asset, but they must be used within the boundaries of your role. Communicating directly with the patient in your shared language is allowed, only if you've been screened and listed as a qualified bilingual employee. Interpreting for others, however, is not permitted unless you've completed formal medical interpreter training and been authorized to do so. Following these guidelines ensures compliance with the law and upholds the highest standards of patient-centered care. In short, this brings us to the second service we provide, identifying employees' bilingual competency. We do this by screening the results of the staff language skills survey, updating the qualified bilingual employee list on a monthly basis, and coordinating language fluency assessments when needed. This process is required by the U.S. Department of Health and Human Services policy, and it ensures that an employee's bilingual skills are sufficient to support safe and high-quality care when communicating directly with patients in their preferred language.
An exciting opportunity if you are a qualified bilingual and want to support language access on a volunteer basis. We offer a free 48-hour medical interpreter training program. You'll need your supervisor's approval and must pass a bilingual competency screening. Once completed, this training also fulfills the training requirement to be eligible for national certification exams for medical interpreters. If this interests you, reach out to our team. We'd love to hear from you. This is the third service we provide to employees, medical interpreter training.
Hi, my name is Lauren Sabatino, American Sign Language interpreter for Medisys. The fourth service we provide is translation. Most of our critical forms have already been professionally translated and uploaded to Epic in the top 3 non-English languages preferred by our patients. In addition, many other documents have been translated into a wider range of languages depending on the needs of the requesting department. If you have a document that needs to be translated, just reach out to our team. All we need is an editable source language file, such as a Word or text document, and the target languages you need it translated into. Once we have that, we'll handle the rest, including working with our trusted partner agencies when necessary. Our goal is to make sure that every patient receives written information they can understand clearly, accurately, and in their preferred language.
The fifth service we provide is auxiliary aid. To tell you more about this important area, I'll now hand it over to my colleague.
I'm Sarah, one of the American Sign Language interpreters here at Medisys. In the next 2 minutes, you'll learn how to use the tools in the Auxiliary Aids toolbox to assist patients that have a disability, such as hearing, visual, or speech impairment, which affects their communication. The toolbox is now available in every inpatient unit at Flushing Hospital and Jamaica Hospital. Please reach out to your unit's clinical nurse manager to access an appropriate tool. Whenever you check out or return items to the Auxiliary Aid toolbox, always fill out the sign-in, sign-out sheet found on the back of the toolbox cover. Before returning tools, sterilize them according to the hospital policy on low-level disinfection of equipment. Thank you. To assist deaf or hard of hearing patients who don't use sign language, we have a hearing amplifier. Simply let the patient wear the headset, turn it on, adjust the volume, and you can speak in your natural voice. You don't need to speak loudly. Disposable ear pad covers are also included in the toolbox. For patients who are hearing impaired or speech impaired, we also have a dry erase whiteboard and markers for writing messages. Additionally, there's a communication board, also known as a Point 2 communication chart, available in English, Spanish, Chinese, and Bengali. These boards cover common communication needs, such as turning lights on or off and expressing pain. For blind, visually impaired, or low vision patients, we provide a reading magnifier with LED lights and a page magnifying sheet to assist with reading. There's also a signature guide card to help with signing documents. Additionally, for blind patients, we also provide Braille versions of the patient's Bill of Rights, Parents' Bill of Rights, and Breastfeeding Mother's Bill of Rights. You can contact Nursing Administration 24/7 or the Language Assistance Program during office hours to get the Braille documents. Thank you.
Hey there, my name is Viviane Beltran, and I work for the LAP team in Flushing Hospital. Imagine you are at the doctor's office and you are handed a stack of papers explaining your treatment plan. You start reading, but the words are long, the sentences are confusing, and you are left scratching your head. Sounds frustrating, right? That's where our team comes in with our 6th service. Our goal is to make sure every patient can easily understand the information they need to take care of their health. Clear, simple language helps patients feel confident about their care if they are getting lost in medical terminology. Using specialized software, we spot trick terms or complicated phrases and swipe them out for clear, plain language alternatives. For example, instead of saying hypertension, we just can say high blood pressure. For things like that, small changes like that, this makes a big difference. Our mission is simple. We want every patient to walk away with information they truly understand. By doing this, we are not just adding words, we are helping patients feel empowered to take care of their health.
In a quick review, there are the 6 major services we provide. 1. Interpreting. 2. Bilingual Competency Identification. 3. Medical Interpreter Training. 4. Translation. 5. Auxiliary Aid. 6. Health Literacy-Oriented Editing.
Before wrapping up, there are some tips we want to share with you. First, how to work effectively with a professional interpreter. To work effectively with an interpreter, always speak directly to the patient, not to the interpreter, and maintain natural eye contact with the patient whenever possible. This means avoid saying to the interpreter, "Tell him this" or "tell her that." Just speak in the first person when communicating to the patient. Use short, clear sentences and pause frequently to allow the interpreter to accurately convey your message. Avoid using medical jargon, idioms, or slang, and allow time for clarification if needed. Remember, the interpreter is there to facilitate communication, not to add, omit, or explain. So, speak as you normally would in a clinical interaction. Lastly, always confirm patient understanding, just as you would in any conversation, and thank the interpreter at the end of the session. Working as a team with the interpreter helps ensure accurate, respectful, and patient-centered care. How to effectively communicate with deaf and hard of hearing patients. First, it's important to use the terms deaf or hard of hearing, as they are the most culturally appropriate and widely accepted within the community. When interacting with the deaf patient, always look at them directly and speak in your normal tone and pace. There's no need to shout or exaggerate your speech, just be natural and respectful. Be mindful of visual barriers, things like masks, poor lighting, or bulky medical equipment that can block a patient's view of a sign language interpreter or your facial expressions, which are critical for communication. Make adjustments as needed to ensure clear visibility, since sign languages are 3-dimensional visual languages. The most effective interpreting modality is always in person whenever possible. With that being said, Voyce does offer 24/7 ASL interpreting services remotely through iPads, providing access when on-site interpreters are not available. If you're using remote ASL interpreting services, it's crucial to position the iPad or monitor screen directly facing the deaf or hard of hearing patient. This ensures they can fully engage in the conversation and receive all the necessary information through visual communication. Clear visibility is key to respectful and effective care. It's also important to be aware that historically, health literacy rates within the deaf community have been lower than those of their hearing peers. This makes plain language, clear visuals, and patient education support even more essential. Finally, remember that the deaf and hard of hearing community is incredibly diverse. Some individuals use sign language to communicate, others may speak for themselves, and some may use hearing aids or cochlear implants, while others may not use any of those at all. The key takeaway: don't assume, ask. Every patient is different. By taking the time to understand how each person prefers to communicate, you help create a respectful and inclusive environment.
I hope this session has provided you with a clear understanding of how to effectively support patients with limited English proficiency. Remember, our services are here to assist you every step of the way. If you have any questions, please don't hesitate to reach out. You can find our contact information on the Language Bank page of the Medisys intranet. We're happy to answer any questions you may have about language access or how to utilize our services. Thank you for your attention. We wish you all the best in your career.